Hello, and thank you for engaging with our work. My name is Dan Murray. I'm a lecturer on the Radiotherapy Physics programme at Swansea University, and together with Joseph Purdon, the programme director, we've been designing and delivering clinically focused case-based discussions using VIRT, a virtual environment for radiotherapy teaching. Trainee medical dosimetrists are three-year undergraduate students who complete a degree in healthcare science whilst gaining their clinical competence in medical dosimetry and radiotherapy. Their main role is that they're involved in the production and quality assurance of complex radiotherapy treatments for cancer patients. They work alongside specialist clinicians who choose the appropriate course of treatment for every patient. For example, they'll use complex computer software to maximize the dose of the patient's tumor, whilst avoiding their non-cancerous tissues or healthy organs within the body as much as they can. As part of this clinical training, summative case-based discussions are completed. The main role is to assess the student's clinical knowledge and understanding of this radiotherapy planning process. For each CBD, a clinical case is reviewed and the wider pathway is discussed. And then student-created treatment plans, radiotherapy plans, are central to this assessment. Previously, CBDs were only conducted in clinical practice because access and use of these plans in a university environment was limited. This presented a problem because to maintain rigorous academic standards, a need for one of these students' case-based discussions to be completed in-house by academics was identified. It could then be moderated alongside the clinical CBDs to ensure they were all delivered at a suitable level. To ensure these CBDs was as close to his clinical practice as possible, virtual simulation was employed as an assessment method. VIRT, so the Virtual Environment for Radiotherapy Teaching, replicates the same clinical environment used in radiotherapy, but in virtual reality, with interactive tools to evaluate, present, and discuss similar clinical cases. CBDs conducted using virtual simulation present an opportunity for the academic faculty to evaluate a student's practical competence, which mentors previously only determined in clinical practice. Clinical pressures, the pandemic, and remote working all test CBDs as an assessment tool to its limits. CBDs using virtual simulation were explored in response to clinical pressure and offer a meaningful and robust assessment method for academic staff. So a simulated clinical scenario was prepared by academic staff and given to the student in advance of the case-based discussion. A case brief was provided 3 weeks before the assessment, containing an anonymized patient history and the patient's treatment plan information. VIRT was then used to present and discuss concepts in a virtual environment, relating them to the patient's case. So by using VIRT's error simulation tools, routine radiotherapy quality control tests can be influenced by a percentage error. This will closely replicate typical errors that can be seen within clinical practice too. Treatment methods can also be compared, providing opportunity for the student to evaluate the advantages and disadvantages of alternative treatment techniques and approaches for each patient's case, and in particular this patient-specific case. Medical images visualized in 3D can provide visual aid for the student's presentation of the patient's clinical history, as well as a method to review the student's knowledge and understanding of the patient's internal anatomy. And then guided by questions from academic staff, the student was then assessed on their knowledge and understanding of each learning outcome using the level 6 marking criteria. In this case, the CBD was conducted in person. However, this can be completed remotely. The student begins essentially by delivering a PowerPoint covering the case details, as well as further reading and research to support the discussion. And as the VIRT software can be remotely accessible, these presentations and assessments can be deliverable over Teams or Zoom as required. Within many clinical programs, there is a significant onus on clinical mentors to assess the students' clinical competence whilst completing their own clinical responsibilities as qualified practitioners. For example, clinical pressures at the moment, such as high patient numbers, complex treatments, and shortened treatment pathways can all impact on the time dedicated towards the student's assessment. In addition, infrequent assessment can lead to mentors lacking the confidence and experience to appropriately assess the students at the required level, as well as hesitant to deliver constructive criticism if they're not delivering these assessments regularly. All of the points above can have a direct impact on assessment rigor within a clinical setting. So by bringing some case-based discussion assessments back into the university, we can ensure assessment standards remain high whilst reducing the clinical pressures for our placement partners. VERT is the only system to simulate radiotherapy environments in this way, with functionality that supports critical discussion and evaluation of clinical scenarios. Assessment in the university setting helps maintain fair assessment and provides an opportunity for the external examiner to input into the simulated clinical assessments themselves. Students' performance during the assessment is also not subject to clinical pressure or differences in clinical practice between mentors and between different placement centres. Thank you for listening to my presentation. If you wish to contact us directly to ask any further questions, please refer to our email addresses displayed on this slide. Thank you very much for listening.